Cerebrovascular accident is the medical terminology for a stroke. A stroke happens when blood cannot flow through because of blockage or a rupture of the blood vessel. There are two major types of stroke. One type of stroke is called ischemic stroke. This type of stroke occurs when an artery in the brain or to the brain is blocked by a blood clot. Therefore, blood cannot pass through and feed brain cells with oxygen and nutrients, and as a result, the brain cells die. This is a more common type of stroke among patients. About 85% of strokes are ischemic. With ischemic, there are two types. One is called thrombotic, which is when an artery becomes blocked by a blood clot formed within the brain. Blood cannot flow through, resulting in damage or death of brain cells. The other is embolic, which is when a blood clot is formed in another part of the body, such as the heart. The clot is swept through the body and eventually gets lodged in the brain. Thus, blood cannot flow through, and brain cells damage and eventually die. Now, this first illustration is an ischemic stroke. I suspect this is an embolic stroke, as it looks like the clot was traveling up to the brain. It got lodged and blood is unable to pass through, causing this white part right here as damage to the brain. And here is the clot, so it looks like it was coming from maybe the heart right here. And then you can see what the artery would look like, and here's the blood clot, and of course there is no way the blood can flow through. The other type is called hemorrhagic stroke. This is when a brain aneurysm bursts or blood vessel leaks. Blood spills into or around the brain, creates swelling or pressure, which causes brain cells to die. This also has two types. Subarachnoid is when an artery bursts in the space that is between the brain and skull, causing the blood vessels to widen and then become narrow. This results in limited blood flow, causing damage to brain cells, which eventually will die. Intracerebral hemorrhage is when blood vessels burst and blood spills into surrounding tissues, which damages the brain tissue. And this second illustration, as you can see, this is the area of hemorrhaging right here. And this is what the vessels will look like if it were to burst and blood spills out. Here. Now, transient ischemic attack, or a short name is TIA, are mini strokes. So TIA are ischemic or hemorrhagic, but occur for a brief period, maybe about 5 to 20 minutes. TIA do not generally cause permanent damage. However, it can be warning signs that a major stroke may happen in the near future. So again, here's an illustration. And here's the blockage right here. So here is where the brain is temporarily blocked because of the blood flow. But then again, if you see what's inside the artery, it looks like very small clots, and they'll eventually break up, and then the blood just continuously flows through. So that's why there's not too much of a permanent damage, but it's still very dangerous. Symptoms. So there are several symptoms, and sometimes a person does not know he or she is having a stroke because they're so regular, and it's very sudden. So one is trouble with speaking and understanding. So a person may be slurring words or can have difficulty in understanding speech. Another symptom is paralysis or numbness of the face, arms, and legs. So the person cannot feel or cannot move the arms or legs. It can even on one side of the body. Also, the mouth, one side of the mouth can be drooping, or one eyelid could be drooping. Trouble with seeing or in one or both eyes. So person may have blurred or blackened vision, or he or she may be seeing double. Headaches that are severe, and again, this is very sudden, and then it's accompanied by vomiting, dizziness, or altered consciousness. So that could be another sign of stroke. Trouble with walking. Person could be stumbling or experience sudden dizziness, loss of balance, or loss of coordination. So here is just like a warning sign for, that's posted, and I've seen these in hospitals. So everything is sudden, sudden numbness, sudden confusion, sudden trouble at seeing, sudden walking, sudden severe headaches. So I've seen this act fast. So FAST is really an acronym. So if you know, or if you suspect somebody is having a stroke, you can look at 4 things, and F is the acronym. So first of all, F is face. So ask the person to smile. Does one side of the face droop? A, the arms. Ask the person to raise both arms. Does one arm drift downward, or is one arm unable to raise up? S, speech. Ask the person to repeat a simple phrase. Is his or her speech slurred or strange? And T for time. If you observe any of these things, please call 911 immediately. Treatment. So there are several treatments of a stroke. So for ischemic stroke, potent clot bursting drug called intravenous injection of tissue plasminogen activator, or TPA, is administered 4.5 hours after stroke. This drug is so strong that a patient may fully recover from a full stroke. Hemorrhagic strokes, stopping of the bleeding in the brain as well as reducing pressure in the brain, is very important in treatment of a hemorrhagic stroke. And surgery, usually it's surgery that performs the stopping of the bleeding or reducing pressure. Now, if an aneurysm causes the hemorrhagic stroke, there's several surgical options. One is called surgical clipping, endovascular embolization, or simply removing the aneurysm. Rehab. So depending how severe the stroke or the location of the stroke, a person may need to relearn everyday activities. And a stroke, so if the left side of the brain is damaged, which causes speech and language speech therapy is required for the person to relearn how to speak and express, do verbal expressions. Swallowing, breathing, walking, seeing may be impacted by stroke all at once, and therefore a patient may have to go through rehab for the rest of his or her life. So this is a picture of physical therapy. A stroke victim is learning how to re-walk again. Right here. So a person has to be very patient. It takes time, and as soon as a person can get through rehab and has the strength to do it, he or she can fully recover. Prevention. There are many factors that increase a person's risk of a stroke, but also a person can decrease that risk by changing his or her lifestyle. One thing, having and maintaining a healthy diet. Being overweight or obese is simply not good for the body. So if a person can, maintain the weight through healthy diets, such as staying away from processed foods, keeping vegetables and fruits and natural foods in your diet, maybe working with a nutritionist, will also help decrease your factor in having a stroke. Regular exercise. Regular exercise is always very important. And this means not just joining a expensive health club such as Lifetime or running marathons, but a person can walk every day, doing brisk walks around the block, 20 minutes, 30 minutes a day, as long as the body is moving and the blood is pumping and the heart is pumping blood. Avoiding smoking and drug use. And that's not just for stroke, but also for avoiding heart attacks and other diseases. Having blood pressure and cholesterol checks regularly. A person can buy those blood pressure machines, and they're portable. And a person can buy it at a Walmart, and he or she can check it every day throughout the day. Cholesterol checks. Person should see the doctor on their 1-year exams, and having cholesterol and just knowing where the cholesterol level is also good. So stop, act, prevent. This was my presentation. It was very enlightening. I found it very helpful for me. Stroke runs in my family, and it's sad to see family members go through a stroke and having to relearn everything. But a person can really recover as long as he or she keeps a good lifestyle and work hard to go through rehab. Thank you very much.